Hi everyone, my name is Sarayali Shubashiam and welcome to my neurology channel. This is my first video ever, and so please watch this video, like it, subscribe to my channel, and comment down below. I will be reading all of your comments. I will be looking at your compliments and your suggestions for improvement, and I will definitely take into account all of them. Just a quick overview of what will happen in this channel. I will be going over neurological disorders, diseases, syndromes, even very simple things like headaches, which is my first video today. So let's get to it. We all know what headaches are. Headaches are a pain in our head or our neck, and it hurts, but it'll go away. We could just take an ibuprofen pill and be done. There's so much more to headaches. This video will include what are headaches, what are the different types of headaches, and what causes them, what are their symptoms, how do doctors diagnose and treat them, and how can we prevent them. So let's get on to it. Headaches. What is a headache? Well, a headache is a pain or discomfort in the head or the face, and they vary greatly among a whole bunch of people in the location of the pain, the intensity of the pain, and how often the headaches occur. In general, for people, brain tissue doesn't have pain-sensitive nerve fibers, which means brain tissue doesn't feel pain. And so other parts are responsible for headaches, such as the network of nerves that extend over the scalp. So, which is why some people get headaches when they pull their hair back in a ponytail or a bun too tight. Another cause could be the nerves in the head, in the face, mouth, and throat, which is why I get headaches when I clench my jaw, not throat, jaw. Also, muscles in the head, neck, and shoulders could be a cause of headaches, which is why people roll their shoulders back and forward, and they move their head side to side to relax their muscles and avoid headaches. And lastly, blood vessels found along the surface and the base of the brain could also be responsible for headaches. There are 3 different types of headaches, the first one being a migraine. In a migraine, symptoms other than pain occur. Some common symptoms could be nausea, vomiting, lightheadedness, photophobia, which is sensitivity to light, and other visual symptoms. In a migraine, there are 4 distinct phases. Now, just a note, not everyone experiences all the phases, and they can vary per person. Like I said, headaches vary greatly. So, the first phase is called the premonition or prodromal phase, where there is a change in behavior or mood that occurs hours or days before the headache. The next one is the aura phase, where a group of visual, sensory, or motor symptoms precede the headache. There are visual changes, hallucinations, numbness, speech changes, and muscle weakness too. The third phase is the headache phase, which is the period during the actual headache with the throbbing pain on one or both sides of the head. Common symptoms could be photophobia, sensitivity to motion, depression, fatigue, and anxiety. Now, obviously, there could be more, but these are some very common symptoms. The last phase is the resolution phase, where the pain lessens. It is replaced with fatigue, irritability, and trouble concentrating. Some people feel refreshed after the attack, but others don't. So, like I said before, it varies greatly. The next 2 types of headaches that I will be talking about are tension headaches and cluster headaches. Tension headaches are the most common type of headaches. Why? Because stress and tight muscles are often factors. We all experience stress. Teenagers and maybe even fourth graders, fifth graders, middle schoolers have tests and quizzes and homework. And the college students have essays, they have to do internships, the parents have to deal with kids, and they have to work hard, and anything could be stressful. Honestly, anything could be stressful, and that stress could cause tension headaches. Most common symptoms would be things like a slow onset of headaches. The head hurts on both sides, and it feels like there's a dull pain or a band or vice around the head. The pain that comes from tension headaches, it's mild or moderate, but it's not severe. And do take into account that tension type headaches do not cause nausea, vomiting, or photophobia. Those happen with migraines, not tension headaches. Cluster headaches usually occur in a series and they last weeks or months, so they last a long time. The most common symptoms would be a severe pain on one side of the head, usually behind one eye. And that affected eye may be red and watery with a droopy lid or a small pupil. There could even be swelling of the eyelid, a runny nose or congestion, and there could also be swelling of the forehead. Well, what causes all of these headaches? Headaches are classified as two types, primary and secondary. Primary headaches are when the headache is the main medical problem. Other factors could be identified, such as muscle tension and exposure to certain foods. And there could be other contributing factors, such as medicines or dehydrations or hormone changes. The second type is the secondary headaches, which are related to an underlying medical condition. So they could be related to a neck injury or eye problems or infections such as jaw, teeth, or sinus infections. What are the symptoms of a headache? It depends on the type of headache. Frequency and intensity of the symptoms also will vary. So typical symptoms would be the slow onset of the headache, the head hurts on both sides of the head, the head hurts on both sides. There you go. The head hurts on both sides. And there could be nausea or vomiting if your headache is a migraine. But like I said before, take into account that tension type headaches do not cause nausea, vomiting, or photophobia. So if you are vomiting and you have a headache, it's not due to stress, it's due to a migraine. The symptoms for headaches may look like other conditions. So like other conditions could have headaches as a symptom. And you can have headaches that could be due to underlying conditions. Like I said before, like the whole difference between primary headaches and secondary headaches. So make sure you check with your healthcare provider for a proper diagnosis. How are headaches diagnosed? Well, doctors will first do a comprehensive medical evaluation and diagnostic testing. They will also ask you about your medical history. Doctors will also do a physical exam and certain tests. So common questions would be things like, when do the headaches occur? What is the location? How long do they last? Do position changes or sitting upright cause the headache? Do you have trouble sleeping? Do you have a history of stress? And is there a history of head injury? Now, if the neurological exam is normal and the doctor suspects a migraine or tension headaches, no further testing is done. However, if it's not a primary type headache, which means if there is an underlying condition, Then other tests will be done to find the cause of the headache, which is find the underlying condition. So some tests would be things like a blood test, which is a blood chemistry or lab test run to check for underlying conditions. There could be sinus x-rays, which is an imaging procedure done to evaluate for congestion or correctable problems. There could be a CT scan or CAT scan, which stands for a computed tomography scan. Or there could be an MRI scan, which is magnetic resonance imaging, which says right here what they are. Yeah. Okay. How are headaches treated? Well, doctors decide on the best treatment based on your age, your overall health and medical history, how sick you are, the ability to handle specific medicines, procedures, or therapies, the time condition is expected to last, and obviously your opinion or preference. Because the main goal of the main goal for doctors is to stop headaches from happening. How are they treated? Well, effective headache management depends on finding the headache type, and they may include avoiding known triggers, changing eating habits, exercise, resting in a dark, quiet environment for some people, medicines, and stress management. Migraine and cluster headaches may need specific medicine management, so they could use abortive medicines, which act on specific receptors in the nerves and blood vessels in the head to stop the headache. You could have rescue medicines, which are brought over the counter to stop headache. Rescue medicines we all know as over-the-counter medicines, over-the-counter drugs, things like that. And the last one are preventative medicines, which are taken daily to reduce the onset of headaches. Some headaches may need medical attention, which means you will have to go to the hospital, maybe even put into surgery, taken to the ICU. And the treatment is individualized depending on the underlying condition causing the headache. So full recovery will depend on the type of headache and other medical problems. So like I said before, how can headaches be avoided? Make sure you avoid known triggers. So that could be eating certain kinds of food, like, I don't know, hamburgers or fries or cookies. I'm just picking food off the picture. Reducing stress. Stress management is very, very important, not only to your careers because of time management too, but also to your health. Reducing stress means reducing headaches. And you can also avoid headaches by taking daily preventative medicines to reduce the onset of the headaches. When do you call the healthcare provider? Well, most Most headaches can be managed with over-the-counter pain relievers. So call if the severe headache is accompanied by stiff neck or nausea or vomiting or shortness of breath or muscular weakness or even change in level of consciousness. That's a red flag. And symptoms that may suggest a more severe or serious headache could be the worst headache ever, or a new type of headache. Could be a headache that follows a head injury, or vomiting without nausea, or personality changes and seizures. You want to go to the hospital. And these are my sources. I felt uncomfortable leaving that out because I have always cited my sources. This isn't correct MLA, just letting you know, because in case your teacher asks, hey, do MLA formatting, and you copy off mine, I will be responsible. Okay, this is not MLA formatting, but these are just websites that I got my information and pictures based off of. It says at the bottom, the last website, hopkinsmedicine.org. That is where I got my information for this video from. Shout out to Johns Hopkins. Yeah. Well, thank you very much for watching my video. And like I said at the beginning, like this video, subscribe to my channel, and comment down below. I will be reading all of your comments, and well, we'll see you next time. Bye.